It is true that the pandemic is a new health issue, but more than that, it's not only a new health issue, it's a layer of complexity that is superposed to all the previously existing challenges and symptoms that become exacerbated due to this layer of additional complexity, right? Yeah. So it doesn't make previous challenges disappear. It makes previous challenges, including and mainly a key one, including inequality, that become more evident, more obvious. One of the reasons why we are so privileged is because we have access to information, right? To reliable information very quickly and worldwide. So we were quite fast in understanding what for most of the people was extremely complex and could only have piecemeal approaches here and there. We saw then that the impact that such decision would take would be huge. I mean, it would be huge for the economies of the countries, but mainly for the economies of the people, right? I mean, it would exacerbate inequality. It would have an impact on school attendance, mostly of the most vulnerable people. It would have an impact on income, again, of the most vulnerable people. It would have an impact on health. And there are some estimates now of 130 million people not receiving other kinds of vaccines, right? 500 million people transitioning towards poverty. So, of course, we are UNDP, we read it from the human development perspective, and actually last week, the Human Development Report Office released some information, and for the first time in 30 years, for the first time since the Human Development Index is being measured, there is gonna be a decrease. Even with the crisis of 2008-9, the increase was slower, but the HDI kept increasing. Here, for the first time, it's going to decrease because of the reasons I'm mentioning now. So we could see it, and then we started to reflect on what was the real issue. And you know, sometimes when you don't use the proper words, then your mindset goes in the wrong direction. So people speak very much of social distancing. Social distancing is not the issue. Physical distancing is the issue, and that was the first maybe finding, right? You need to speak of physical distancing, and that will allow you to think a little bit more on what the issue is. The issue is that the COVID-19 is spread, the infection happens through your eyes, nose, and mouth. And that's it. There is no more than that. And that changes the situation quite a big deal, because if you think on those terms, actually what you need to isolate is your eyes, mouth, and nose. That's it. You don't need to isolate your body. You don't need to isolate and have, I mean, to make it simple, and we use different techniques of innovation, but basically what you would need is to put yourself in a bubble, and you could be safe, and you could actually retake your economic activities and whatever within your bubble. But then it's not a bubble, because actually what you need to put a bubble in is your head. Yes. And then if you think of a bubble in your head, what you actually need is a helmet. And then if you think of it a little bit more, because it's not a motorbike that you're riding, it's not that you're gonna hit your head, it's not even a helmet, it's a face shield, it's a proper face shield. I mean, the real challenge here is, how do you change behavior? Why I'm saying this, if people have the habit of being 2 meters apart, and they had a habit of not touching their face 10 times per hour, then there would not be any issue. Yeah. If you were keeping 2 meters distance and you were not touching your face 10 times per hour, you couldn't contaminate others and you couldn't contaminate yourself. That's why we launched a contest, right? Because we needed as many people as possible thinking that this was a possibility and how to go about it. That was number one. Number two, if you see in COVID times, the time speed accelerates, like everything is way faster, people fall into poverty faster, everything needs to happen very, very quickly. So we needed to get the best of each of the actors. And private sector has some things that they are amazing and only they can do, but then the makers have some things that they are amazing and only they can do, and then the academia has some things that they are amazing and only they can do, and the government has things that they can only do, and we have our things that we can only do, right? So we wanted to take the best of each of us. And that's how we started from the early stage. I mean, before we launched the contest, we spoke with the ANDI, the National Association of Industry, and we wouldn't speak to one specific company in particular, because we as the UN, as a UNDP, we cannot favor one given company, but we can favor sectors, right? So we spoke with the Industrial Association that would bring under its scope all the companies of the industrial sector. We spoke with the vice president who, as I said, they knew that they needed to find a solution that could be not between lives and livelihoods, but that could actually be a bridge. And she could see that this could be a bridge because it could enable the population, and also the most vulnerable population, to gradually reactivate the economy while protecting the spread. We included academia, and we wanted to have, and we are very, very, very proud of collaborating with you, and we are collaborating with the EAN, and we are collaborating with Yale University, for instance.
How do you see the challenges of that multi-actor approach?
You could think of it as an orchestra. So you can have instruments playing separately, or you can integrate the instruments, and the joint effort of all these instruments properly integrated will bring a completely different result, right? So if we only left each of these actors go on their own, then probably the things wouldn't move, or would take longer, or would go in different directions. But what we needed is to take the best advantage of each of the actors. So to give you an example, people that competed in the contest, and there were all sorts of people. There were students, there were makers, there were companies. Again, each of the actors has a role to play, and if properly organized or coordinated, then you can go way quicker and have a much higher impact. No? Here we understood that the life helmets were the enabler of the rest of the things that would come. Not only physically, but again, psychologically, the idea, the notion of understanding that it's not either lives or livelihoods, but there is a mid ground that needs to be worked through, that was extremely important.